On to health matters now. Contraceptives are devices or drugs used to prevent pregnancy and, in some cases, sexually transmitted diseases. Now, joining us today is general practitioner, that is Dr. Shayela Makemba. Doctor, a very good morning to you, and always a pleasure having you here.
Thank you very much for having me once again on the program, and good morning to our viewers at home.
Yeah. Let's just start by looking at the various types of contraceptives that exist.
All right, basically, I'm going to try and highlight what we have in our market here locally. As we have earlier said, of course, a contraceptive is either a device or any medication that are used to prevent pregnancy. Now we have about broadly 5 categories that we're probably looking at in our local setting here in Namibia. We've got tablets. Of course, there are quite various different types of tablets that, of course, we make a choice based on the need of women in question. We do have injectables, be it Depo-Provera or Noristrate, which we also do inject from time to time. We do have patches that a woman can sort of put on their skin that also do help with the prevention of pregnancy. We have implantations that we insert under the skin. And then, of course, we have what we call an intrauterine contraceptive device, where we insert it basically into the uterus.
Okay.
Yeah, basically, by far, those are the options that one have in our settings.
How effective are these contraceptives?
The contraceptives, by nature, they are very effective if a woman follow all the instructions that are provided, of course, with the package that comes with them. Yeah. Tablets, you have sort of, different types of tablets that comes. The way they are packaged is that you got about 21 active ingredient and 7 placebo. Normally, once, the woman take the medication or they are on the tablets, of course, if she's taking it, as indicated, she should be safe. Yeah. Injections, of course, easy to use. You just walk into the doctor's office or into the clinic, they inject you with the injection. Then, of course, you come follow up based on, the duration. It be 2 months or 3 months. Yeah. The intrauterine contraceptive device is user dependent in a sense that you probably want it inserted by somebody who is very experienced. Because if a physician or a doctor is not as very experienced and they don't put it in properly, it can easily slip out and the woman might not even realize it has slipped out. Yeah. Yeah, of course, the patch is quite effective, but the packet insert is actually, saying that if a woman is to go on a patch, and especially if she's using it for the first time, it is actually advised that the first box that she's using, she should exercise extra precaution, because then the system has to get used to absorbing the ingredient through the patch into the skin and then into the system. Yeah. The implanton, on the other hand, of course, if one insert the implanton within the first 5 days of the woman having gone on the period, it's effective immediately. But of course, if she have used it before and now maybe it was taken out and she's putting it in again for the second time, it's actually advised that she exercise caution for the first 7 days, and then thereafter everything should be fine.
Okay, we know about the advantages of these contraceptives. Yeah. Let's speak about some of the disadvantages, for instance, in terms of the unsupervised use of contraceptives, etc., and how harmful these may be.
Right. Generally, the disadvantages is quite, be it supervised or unsupervised, probably, they all tend to have the same disadvantages, which we often refer to as side effects. If a woman goes on contraceptives, she can easily develop breakthrough bleedings, which means she can bleed excessively sometimes, depending, of course, on how she responds to the contraceptives. She can also develop, breast pain sometimes that can happen. There are some contraceptives that are also known to cause headaches. Of course, contraceptive by nature do not necessarily prevent the transmission of sexual diseases and infections. It only prevents pregnancy. Of course, women out there have to exercise extra precaution to keep themselves protected as well. Yeah, basically in a nutshell, that's what tend to happen, when one is on contraceptive. Nausea can happen. Also, some are known to cause weight gains. Some women go on contraceptive and then all of a sudden they start, picking up weight and stuff.
Picking up weight. That is supervised also.
Yeah, supervised or unsupervised. The outcome is often the same.
Okay. Let's talk about the implant that you spoke of and how it is inserted and how basically it works, it functions in the woman.
All right. The implant, or what we refer to as implanton, is actually a progestin-only contraceptive. It's a little device that comes into a syringe, a preset syringe. We normally insert it in the upper, arm on the left side, just above the elbow. it's quite easily inserted. What a woman then does is, if she desires to have an implant inserted, she goes to her doctor. They, of course, have to discuss the pros and cons surrounding it. The lifespan of the implant is 3 years, which means if one insert the implant, it is effective for a period of 3 years. And of course, choices are then, of course, informed by whether a woman, desires to have more kids and how she wants to space a family, or if she doesn't have to, if she doesn't want to have kids. So, depending on where she is with her life and what's happening around their life, that's when we make a choice of inserting the implant. It's probably not advisable for individuals that have had a deep vein thrombosis or pulmonary embolism. If you look at the packet insert, it also says that probably not ideal to put it in when a woman has a severe liver condition with maybe abnormal liver functions. Individuals that have a cancer like ovarian cancer and breast cancer, probably also not a good advice. Why? Because some of these cancers are driven and are influenced by hormones, and the hormones that are released by the device can actually be of detrimental outcomes.
Are these contraceptives 100% proof against falling pregnant?
Yes, I would say I'll answer that question like this. We have heard and seen in practice individuals that have gone on contraceptives and then fall pregnant while on contraceptives. Of course, the idea is to probably look into the effectiveness in terms of is the person using it as prescribed. For instance, a patch. I think from my personal experience, I've had a few patients. They came in and they wanted a patch, so I have to prescribe a patch for them. But then I do give them clear instruction on how to go about using the patch. But sometimes, it's a human weakness. Sometimes you give information, but it doesn't filter down properly. You find somebody get a patch, they get it for the first time from the pharmacy. Let's say they're knocking off around 5, they get home and they put the patch maybe later that day. Then they get intimate with their partner without any other form of protection. Of course, then you run a risk of falling pregnant. Why? Because the system hasn't really kicked in very well. So the idea for the ladies out there is that when you go to your doctor and you're about to inquire anything concerning contraceptives, you want to get to have all the information that there is, get to understand how to use, the type of contraceptive that you opted for, and follow the instruction to the letter. In that way, then it becomes effective. But if you do not follow instruction properly, sometimes you run the risk of running into trouble.
What is the approach to contraceptives usually? Is it a couple's approach? Is it the woman by herself seeking contraceptives? And what is the role of men in the selection of contraceptives?
All right. There is 2 schools of thoughts to how you basically approach contraceptives in relation to a lady. The first school of thoughts will be, of course, we need to respect women's right, their own choice to how they want to live their lives and decision they make concerning their body. Now, probably that will be just in maybe a girlfriend-boyfriend relationship. But, of course, when you come into a setting where now individuals are married and there's a family involved, of course, depending on the decisions the couple have made, how many children they want to have, the spacing of the children thereof, you then have to involve a man. Now, oftentimes, it's actually just more informative to have both, couples present. But if it's a young, unmarried single lady or just somebody in a boyfriend-girlfriend relationship, probably, the choice is probably left to a lady to make.
Just lastly, doctor, how common is the use of contraceptives as a tool of family planning? We know that it wasn't a very easy thing to adopt back in the day, but now we see more and more people taking that route. How common is it now?
I would say the numbers are picking up, all right. But I still. From, of course, the practical and the experience that I see in clinical practice is that, especially in our African settings, most of the mothers are not so comfortable with their, younger daughters going on contraceptives and, getting involved with aspects of contraceptives. The message is filtering down, but slowly, there has been an improvement, of course, compared to previous times. But I think there's still a lot of ground to be broken there, and, more information need to go out to the community.
Fantastic. Doctor, thank you so much for joining us this morning.
Thank you very much for having me on the program.